Hi, everybody. Welcome to our newest edition of Talk It Out, where we're talking about mental health concerns around the UCSD community and specifically towards men at UCSD and trying to bring these issues to light. We don't talk a lot about mental health, and so I think it's good to have these conversations. Today, I'm joined by the wonderful Tim Stempel, and I'd love for you to introduce yourself, sort of what you do here at UCSD, and sort of what services are available for UCSD men.
Yeah, awesome. Christopher, thank you so much for having me. I really appreciate the opportunity to come in and talk today. So my role is the social worker at the Student Health Clinic. And what I do as a social worker at the Student Health Clinic primarily is connect students with mental health resources. And so that really kind of represents the lion's share of the work that I do, helping them kind of navigate who would be an appropriate provider, kind of understanding the different treatment options that they may have, and then being able to connect with the resources that are available both on campus and in the community. I help with a variety of other things too. And so, students facing any kind of adverse impact on their education and their ability to be successful at UCSD is, I kind of tell them is sort of fair game for us to discuss and problem solve. And I hopefully can get them pointed in the right direction. But really the bulk of what I'm doing is helping people connect to mental health resources.
That's fantastic. And I'm so glad you're here as a resource for students as well. The students, obviously, as you know, experience so much variety of things throughout college, especially over the COVID-19 pandemic. It's been a lot of challenges that students have experienced that all of us have been hearing from students. And so having lots of avenues and opportunities is really important. Sort of to begin the interview today, the first question I have for you is just, why is mental health important to you as a person, and especially in regards to college student mental health?
Yeah, absolutely. So for my journey, kind of getting into the mental health world, actually, I worked at a wilderness therapy program, and so I was working with teenagers in a outdoor setting where they were struggling with a variety of mental health concerns, anxiety, depression, failing in school, drug issues, a variety of things, and I really saw the kind of like the value of having an emotional experience and being able to process that and understand what you're experiencing and dealing with. And I really wanted to learn more. And so that was what kind of initially led me back to go to graduate school to get my degree in social work and kind of enter the mental health field. And then being on a university campus, I find it such a rewarding and inspiring place to be. The students are in such a remarkable time of development and growth. And I think that for me is really inspiring to help people along that path and that journey, and helping them be as successful as possible in their endeavors, both on and off campus. And so I think then, I see mental health as both sometimes as a kind of barrier where people are kind of struggling with something and dealing with that and trying to work through that. And then also as, kind of the other hand of like being this sort of opportunity for growth and learning and inspiration where, maybe having overcome something or dealing with something in a new way that enables them to kind of move forward and access new opportunities is always really exciting to me to be able to participate in that.
That's awesome. And I feel very similarly. It's so nice to help these students grow as possible and like really meet students where they're at and see everyone has such unique challenges, right? And I think it's so fun to help students overcome those,
right,
and also be able to provide those resources where available. Yeah, so that's absolutely. Really wonderful. What's one thing that you wish men knew about mental health and behavioral health counseling and case management? And sort of as part of that question, and aligned with this Talk It Out theme, of how do we raise awareness around these things as well?
Right. Yeah. So great question. Really interesting question. I think to ponder, like, what is one thing that I would think is really important for people to understand? And I think there's a variety of stereotypes around sort of like the culture we have as men and this idea of toxic masculinity. And I guess the thing that I would hope that people understand, or that men understand, is that that there's real opportunity for like personal enhancement and growth in the world of mental health, in the field of mental health, and that it's not just about going back and looking at what your family history was or your trauma was. It's also forward looking in many cases too, and like opening doors and seeing new opportunities. And I think that you know, for a lot of people can be inspiring, rather than sort of just having to dig through old trauma or old hurts or old issues. That, you know, that doesn't feel good, but to be able to take that and how do I use that as a platform and a foundation to kind of move forward and to kind of you know, go after the things that I want to see in my future and in my life. So I guess that would be one thing that I would want to point people toward.
Gotcha.
Yeah. What else did you? I know there was another part of that question. Now I'm like,
totally.
yeah.
Just sort of the talk it out piece of that. Of how, on that same note of toxic masculinity and healthy masculinity, and coming forward to actually reach out in the first place for these sorts of services, how would you want to like raise awareness around promoting mental health?
Yeah, you know, I guess my personal default or my mode of operating has always been a relationship-based mode of operating, and I'm one-to-one type of person in a lot of cases, and I think that for me, like, it's important for students who have had a positive experience in a mental health setting to let their friends know. You know, if you're with your guy friends and you're talking about, you know, somebody struggling or being vulnerable or being able to say, hey, I did this and it was really helpful, maybe you should check it out. You know, I think those kind of things go so much further than reading a flyer or even going to a presentation sometimes, because you have the, you know, the direct experience and the direct relationship with that person to say, hey, you might want to try this. It worked for me. And one, not being ashamed to say that, and two, not being afraid to, you know, kind of encourage your friend to get out there and maybe see if there's another opportunity for them to explore too, and get some additional support and have, you know, the help that they may need to help them along their path as well. So I think that's where I kind of tend to feel like, wow, this is powerful, right? When I hear that kind of validation from somebody who I'm close to.
Gotcha. And I think you bring up a really good point when you say that around, sometimes there's this stereotype that mental health or behavioral health means that something is wrong, or that there's an illness or a disease or something. And it could just be something just to talk it out with somebody. So you need someone to hear you say something sometimes.
Right.
And
absolutely.
That kind of takes away that negative stigma of, oh, this is something where something's wrong. And I think opening it up more to saying, well, life can be hard, and having someone to help you work through that can be very helpful.
Totally.
And just like you said, if you've had those good experiences and you're listening today, like, share that with people that you know, and kind of reduce that negative stigma around these services. We have a lot of amazing staff, including this one right here, to help you with these things going on in life, and with academics as well. So be sure to reach out if you think you need those services, but also reach out to your friends and colleagues and coworkers about these same issues. It's very important to have these conversations.
Yeah. I mean, and I think just you know, another thought, and I know we got you know, a couple of things to discuss here, but I really try to take a very holistic perspective when I'm meeting with a student, right? And understand that mental health, you know, is connected to physical health, and connected to our you know, emotional well-being and our social well-being, and all these things have these sort of intersections, and so really thinking about not just do I go and talk to a therapist, but what does my foundation look like? How's my diet? How's my you know, diet and nutrition? How's my exercise routine? How's my sleep? Like, all these things really build such a solid foundation, and I think that those are really important too. And making sure that, you know, we're considering the whole person, and really taking a look at, you know, ourselves beyond just, you know, our academics, or beyond just our emotional distress, and really understanding ourselves in as a whole people in a larger context. So I think that's super important.
I couldn't agree more. I think mental health is one of those things that apply to so many areas of our life. Even in our office with Health Promotion Services, we take a very holistic approach, very similar to that of, yes, this may be the theme of this topic, but it's going to impact your life in a lot of other ways, impact your health in a lot of other ways. And finding ways to bring that together and create a whole sense of health and well-being. We often want to, especially when physical health is concerned, we think about taking a pill to solve a problem or something. And we don't necessarily have that for a lot of other concerns around holistic health. So taking that whole approach is so important to creating not just the internal sort of fortitude to work through some issues, but also of realizing that these things help each other through this process. So that's a really, really wonderful approach. And then sort of the last question I have for you here is, What does that process look like for UCSD men who want to seek out your services? And sort of as part of this, less of the general overview, but more of like, what can they expect if they come into that
Sure.
first meeting? What is that
Yeah,
phone call? What does that visit look like? Sort of taking
absolutely.
away some of those unknowns.
Yeah, for sure. So, so I think I have made an effort to kind of make my services as sort of available as possible, and so it can be as simple as somebody calling the student health clinic and asking to meet with a social worker. You don't have to go through your primary care doctor. You don't have to see a nurse. You don't have to come into the student health clinic prior to getting an appointment to see me, which I think is really important to me to like be able to offer that kind of direct care to students. So, so that's, you know, the easiest way to schedule is to call the student health clinic and ask to speak with the social worker. I'm the only social worker at the student health clinic, so you won't get anybody else. But yeah, and then what to expect. You know, I think generally speaking, I really try to kind of allow the person to tell their story and to have a comfortable space and a free space and a contained space to tell the story that they need to tell, to talk through what's been going on and help me understand where they're coming from so that I can help them find what's going to be the best fit for their particular needs and their particular situation. You know, we have a fairly robust network of treatment providers, both on campus and off campus, that can provide care to students, and you know, whether that's kind of particular demographic preferences that people have, or whether it's particular kind of struggling issues that they're facing, or whatever it might be, that, you know, that really I think we work very hard to kind of help them identify the right provider. And so that's part of the process. We'll talk through that. We'll understand what's been going on. It can be a little uncomfortable, you know, obviously, like telling your story to a new person can be challenging, but I think I really try to create a safe space that allows people the opportunity to talk through what they need to talk through, and then help them kind of access whatever it is the next steps would be. And then from that point, after we kind of close the meeting, I will kind of continue to follow up with them until we know they've sort of landed somewhere and gotten in and felt like they are sort of on solid ground on the next step. And so really I'm willing to offer that kind of continuity until they're landed somewhere else. So yeah, I think that's kind of the bulk of it. That's how it looks, and it's a fairly simple process, but can also, you know, present some challenges too, because like I said, it can be difficult to talk to somebody new about your story. So so always make sure to honor that.
And to clarify one other thing that you said there, sort of a general sort of comment about this. Would you mind sharing a little bit about how what you do as a social worker, like what social work is, and how that is sort of different than seeing a psychologist or a psychiatrist even?
Yeah, absolutely. So so social workers, you know, kind of writ large, tend to be a fairly versatile population of people. We do a variety of different things. In the context that I'm in at the student health clinic, you know, my role is different in that while it is mental health related, and I am a licensed mental health therapist, like I'm not providing therapy per se. It tends to be a little more black and white. It tends to be a little more information gathering, and then a little more oriented toward what's the solution? What are we doing to get you to the next step? How do we help you land there in the right treatment? And so that's really what my focus tends to be. Whereas a psychologist is going to be a little more focused on the longer term understanding and unpacking your history, any potential traumas, any potential kind of points of distress, whether you kind of consistently experience anxiety or feelings of depression, and helping you learn tools and skills to navigate those more effectively. And so that's really tends to be kind of where the distinction is, right? They're providing what we would classically call treatment, whereas what I'm providing is more classically considered to be case management service. And, you know, there tends to be a little bit of overlap, but I think we try to keep them fairly distinct. And then lastly, the psychiatrist, as you mentioned, the psychiatrist is a medical doctor. They go through the same training as any other medical doctor, with the addition of a specialty in mental health care. And so it's just a very different model. Some of them are trained in therapy, some of them are not. Really just depends on the particular psychiatrist, but most of them are working out of a you know, kind of a medical model. Although many of them, you know, many of us in the mental health field work from a fairly holistic perspective and understand that, you know, just one thing isn't necessarily going to fix all the problems. But they will be the ones to prescribe any kind of medication that somebody would want to take for any mental health concern. So I hope that kind of clarifies all the players in the game there. But yeah.
Yeah, wonderful. Thank you so much for that. I think that's a really helpful description.
Yeah.
It's one thing to sort of Google the differences. It's one thing to sort of hear it from the mouths of the people
Right.
who do it. So I
Yeah.
do really appreciate that.
Yeah.
Especially because as students, UCSD students are able to access all of those different resources. So
Absolutely.
sort
Right.
of knowing what the purpose is there is really useful.
Right.
All that being said, I'll let you have the floor if there's anything else you'd like to share.
Yeah, sure. I mean, I guess one of the things that I get a lot of questions about is health insurance, right? Health insurance is very complicated. Our system in this country is a very complicated thing, and the way that it's been set up can be really challenging to understand and navigate. And so I always offer to students, if you have questions about your health insurance, if you have questions about how it works, I'm always happy to help you kind of navigate that, to figure it out, to call your insurance with you. A lot of the students on campus, about half or so, have SHIP, which I'm kind of work with very consistently and more familiar with. Other students may have Medi-Cal or Kaiser or Aetna or Cigna, a variety of other plans, and happy to help work with those too. So it can be challenging and a little daunting to try to figure it out yourself. And so please reach out, even if you just need help navigating your own insurance plan and it's not a SHIP plan. I'm happy to help with that too. So I think that would be my last PSA around health insurance.
This is very, very helpful, very, very holistic, sort of the nature of just the logistics of it as well. So
yeah,
this has been very, very useful. And thank you so much for that. That being said, that's all I've got for you today. Thank you all for joining us for Talk It Out. Thank you so much, Tim, for joining us today as well.
Yeah.
And we'll see you next episode of Talk It Out here at UCSD. Bye, everybody.